Let me know that in the comment section because like wow. Hello everyone, so I'm Christabel, a student pharmacist, and today I'm going to be reacting to the Good Doctor season 1 episode 1. Oh, that looks like construction accident. So that's very good. Whenever an accident happens, so first of all, take care of the injured person, then after that you call 911. Help will come.
I'm a doctor. Let me take a look. His jugular vein's been cut.
So over here, he asked for a clean cloth because he did not want to add up to any infection. So he wanted a clean cloth for whatever he wanted to do. I hope you are getting me.
You're killing him.
I think he was so plain. He did not even beat about the bush. He was so plain. You are
Saving the
killing
blood.
him.
In the wrong place. I think I remember enough of Anatomy 101 to know what the jugular vein is. You would be in the right place if you weren't a doctor.
So over here, the other doctor was trying to say that he knows more of Anatomy 101 for Shaun to be telling him what to do. But I think Shaun was also saying something meaningful over here. So as time goes on, I'm going to be explaining what Shaun was trying to say to you.
Adult, he is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing.
So the jugular veins are the major blood vessels in the neck and they carry the oxygenated blood from the head back to the heart. So what Shaun was trying to say is that in children, jugular veins are more fragile and whenever they are compressed, they can lead to blockage of the airways, but in adults their jugular veins are much more robust such that even when they are compressed to control bleeding, their airways are not blocked. So that was what Shaun was trying to say over here, but it seems the doctor wanted to also show the other. I don't know if he's a doctor, he also wanted to show that yes, he knows something about anatomy. But sometimes I think we should try and listen to other people's opinion. Wow, just seeing all the parts, like if I had this kind of any anatomy exams, like come on, because seeing all the parts just like that on your eyes, wow, should I say it's a talent from God or what? Let me know that in the comment section because like wow, this is just not easy. Wow. So whenever there is an accident, example like this construction accident, and there is an instrument or let's say a glass in this scenario embedded in the person's skin, it is advisable that you don't take it out because you don't know that glass could be serving as a blockade, making the bleeding less. But then removing that glass can also create more room for bleeding. Hence, it is advisable that you don't remove the glass immediately, and it could even cause more harm to the person. Yes, so it's very good that Shaun did not remove the glass directly from the child's skin.
I need a knife. Where do you keep the knives people forget they're traveling with?
A knife. Sure. Anything else?
There's a medical emergency. There's a medical emergency. That one. That one right near the top looks very sharp. Would you get it for me?
Well, I'm not going to give you a knife. I'll ask you.
There's not the time.
Weapon!
So over here, do you think the police was at fault? I doubt because this is actually not right. You can't just go take something and run away. You might even be perceived to be a thief or a criminal. So I don't think the police was wrong over here. I think they did the right thing. Even though Shaun was going to do something right, but then that was not the right way to do it. And I forgot to say this. He used the alcohol on the surface of the injured place because one reason is to disinfect the area and another reason is because he wanted to identify the location or the area of the pneumothorax. So that's one function of using that alcohol over there. So he used alcohol over the surface just to disinfect the place to prevent bacteria infections and other stuffs. But Was that right? Because blowing air into the gloves can also introduce bacteria. But anyway, he washed with alcohol. Fine. But I think he shouldn't have blown air into the gloves actually. So it says tension pneumothorax is usually due to a lung lacuation which allows air to escape into the pleural space surrounding the lung but not to return into the lung. So tension pneumothorax is a life-threatening condition. It's just like the trauma one that we talked about. It's a life-threatening condition where air continues to enter the space between the lungs and the chest wall, but over here, the air can't escape, causing the pressure to build up and push the heart and the lungs to the opposite side of the chest. So, because of the air buildup and the pressure being increased, it pushes the heart and the lungs to opposite sides of the chest walls. So, that's tension pneumothorax. This is just a movie, but in reality, I think it's not advisable to conduct such a huge medical procedure anywhere. It is advisable to conduct this kind of procedure in the hospital, at the hospital, not just anywhere. That's from my perspective because
The chest is moving paradoxically. The left lung is in distress.
so this one says it is a rare sign of high threatening condition known as traumatic pneumothorax. So when we talk about traumatic pneumothorax, it is a life-threatening condition where air enters the space between the lungs and the chest walls, often due to severe injury, just like what just happened over here, due to severe injury and often such as car accidents or construction accidents, fall, and this causes the lungs to collapse. So I think this is what had happened to the guy. That's what Sean was trying to tell the other man over there, that this condition is or might be traumatic pneumothorax.
He's breathing.
And he breathed.
He
He
saved his
saved
life.
his life.
He saved his life.
He needs a standing ovation. So this is where I will be ending for season 1 episode 1. I hope you like this video. Please give it a like and also subscribe to this channel if you found this video helpful. Catch you next time, same time. Bye.